Keeping immunization records up to date is vital for protecting children and supporting the health of our community. Here with an important reminder to parents and guardians is Dr. Azim Kasmani, Niagara Region's Medical Officer of Health. Doctor, thank you for joining us today.
Thanks for having me.
Of course. Now, the Immunization School Pupils Act says that all Ontario students must be vaccinated against 9 diseases or have valid exemptions to attend school. So why don't we go through a list of those 9 diseases just so we can kind of check those bad boys off there.
Yeah, and these are the important ones that make kids really sick. So they're things like diphtheria, tetanus, polio, measles, mumps, rubella, meningitis, whooping cough or pertussis, as well as chicken pox for kids born after 2010.
Okay, so accurate records we know really does help respond quickly to these outbreaks by identifying those at-risk individuals and taking the necessary precautions to protect everyone. Now, how do you identify at-risk individuals and what are the necessary precautions you need to protect our community?
No one wants their kids to get sick, and no one wants to get their kids to get really sick. And so the at-risk individuals would be kids who don't have immunity. So whether that's through an infection, so for example, if you've had measles, measles is one of those viruses you don't get twice. Or if you've had a vaccine, that's a much better way to get that protection because then you don't get all the sickness. We would find those kids or identify those kids who don't have immunity, and we're actually allowed under the Immunization of School Pupils Act to keep them out of school during that time or exclude them so they don't get sick.
Okay, so do you have an idea of just how many students are living in Niagara with incomplete immunization records?
Yeah, and I think what's important what you said there is that incomplete. That doesn't mean that doesn't necessarily mean they don't have their vaccine. It just might be that we haven't received the records yet to update the system. So there's over 13,000 students right now who don't have complete immunization records. Through this process, though, we generally see that number come down into the low hundreds.
And how do parents or guardians update their child's immunization records?
Great question. You'd think, in the modern world, you go, you get your vaccine, your doctor puts it into the computer and it's updated, but it's not. The systems don't speak on the back end. So we don't receive that information, and you actually have to go and fill it out yourself. We're trying to make that easier for parents this year. And so basically what you do is you go online to our website, niagararegion.ca/health. And there's a link there for the system called ICON, where you can actually report your immunizations directly through us. And so you go online, you fill out the online forms there, we get that, and that's all we need. You might be asking, where do I get that information? Where do I know about it? Your family doctor can give you those reports of what you have.
Okay. What would be some examples of exemption for school-age children?
Yeah, so some kids might have a medical exemption. There might be a medical reason that they can't or shouldn't get the vaccine. They might have had an allergy, for example. And there's a couple other ones as well. Again, if you go on our website, niagararegion.ca/health, that's the best place to learn more about it.
And so with annual reviews of immunization records, we know that can help improve vaccination coverage across Niagara. What are, some of the statistics? Are kids getting vaccinated? Are parents doing this? Is it a lack of information?
Yeah, so there's a few reasons why people don't get vaccinated. Again, this doesn't necessarily mean they haven't got vaccinated. It might just be that parents haven't remembered to log on and report that through the ICON system online. The big reasons are really convenience, why people may or may not get vaccinated. Do you have a family doctor appointment, making one of those, and that complacency, do I need to get it done now? And things kind of come up, we're all really busy. And so these are systems to help remind us of the importance of that. Last year, we saw our measles vaccine, or our measles immunization rate increase from 78% of kids to 92% of kids. Polio went from 76% to 93%. Chickenpox went from 66% to 91%. Many of these diseases are making a comeback. We're hearing a lot more about these outbreaks because the immunization rates are lower. So protecting ourselves also helps protect our community because then it's harder for the diseases to pass around.
And so for those parents or guardians that say, okay, this is also overwhelming, what's step one? Where do we start?
I think the easiest thing to do is, one, you would have got a letter. So the Canada Post strike ended. We didn't want to do anything while there was a strike because we wouldn't be able to get people that information. That information has gone out now. It's been mailed out. The letter clearly outlines which vaccine we don't have records of. So it's trying to figure out, do you have that vaccine? Does your child have that vaccine or not? If they've had that vaccine, you can contact your family doctor or wherever they got that vaccine, get that record, and then report it to us online. If they haven't had that vaccine, you can book an appointment. Now, we were chatting a little earlier and you reminded me how hard it is to get an appointment with a family doctor if you have one. We also offer vaccine catch-up clinics, and we'll be doing them through March break and onwards to give people a chance to catch up. If you log on to our website, niagararegion.ca/health, you can book an appointment there, or there's a phone number, 905-688-8248, extension 7425.
Great, and we'll have that up on the screen. And I was one of those parents that got the letter in the mail just yesterday. And so the timing of this interview is perfect because now I know I will call the family doctor, and it's just as simple as saying, I need this specific vaccine for my child.
Yeah, either I need this specific vaccine, or if you know you've got it, can I get those records so I can let public health know when I got it so we can verify.
Okay, and then why don't you just give us that website for where people can go to fill it out online to let the region know that their child is immunized.
NiagaraRegion.ca/health.
Great. Thank you so much for joining us today.
Thanks for having me.
Excellent.